Hey folks, Dr. Paul here. Let's see, that's a little better. I had something on my heart I just wanted to share with people. I was reading something today that there are over 200 million people who are survivors of cancer. And I happen to have read this book, The Truth About Cancer, and was quite impressed. So Ty Bollinger put together this whole series. I think it initially aired a year or two ago, The Truth About Cancer, and then wrote this book, The Truth About Cancer, from taking some of the best of that series that put together, I think it was, hi everybody, thanks for everybody who's checking in, man. I appreciate your attendance to this. This is great. I just got off work. I had a patient today who was 14 years old. Oh, broke my heart. This cutest kid. He's had, well, first presented with a condition where he was not growing in height, really lost his growth, had a kind of a wide face compared to normal, and was struggling with weight. Turned out he had Cushing's syndrome, for those of you who are medical. And then it's like, what? Turns out he had a pituitary adenoma, a tumor in his brain. He went to the local hospital here, OHSU, had surgery, removed it, but it grew back. And this is a 14-year-old with a rare type of cancer that's really affecting his health. And the mom was asking me today, says, what can we do natural? Surely, because they're talking about maybe going in for surgery again. They're not sure they'll be able to get it, and all the possible complications. And those of you who've suffered from surgery, I know you can relate to this. I lost a dear aunt of mine to breast cancer this past year. Too many people are suffering from cancer in our country, in our modern society, in our world, as we've gotten more industrialized, more high-tech, if you will. There are more and more people struggling with cancer. So it was kind of on my heart because I recently was visiting with William Parker at Duke University, and we were just chatting about what's happening to health in America and in the world. And you know, I wholeheartedly agree with something that he was sharing with me that I'm just going to share here. I've believed in these very concepts, but the way he put it to me was so clear, and it relates to this issue of cancer. And that is this: our immune system needs to be balanced. Pharmaceuticals do not balance the immune system, folks. They treat symptoms for the most part, and oftentimes push the immune system towards being hyperimmune. It's kind of random, like throwing grenades at things, and you either get allergies or you get autoimmune problems. And so many of you I know are suffering from autoimmune problems. The other side, if you flip the balance to suppression of the immune system, now you've got cancer, now you've got infections. I was at a conference recently where a diagram was presented of the 20 most profitable pharmaceuticals. Number one, folks, Humira. The profits were in the billions per year. The speaker asked, how much do you think it costs to have a year's treatment of Humira? Anybody have a guess? And we were guessing in the tens of thousands. It was almost $100,000 for one patient. And that drug suppresses the immune system, just pushes you into high risk for cancer. You've seen the ads, right? Risk of da-da-da-da-da-da, make sure you're not infected, that you don't have TB, and it may cause cancer. All right, that's just one simple example, and I didn't mean to pick on one particular drug. It just was, since it's the top moneymaker, it just caught my attention. But we have toxins all over the place in our world, and these things are affecting our risk. But the 5 things, as I was talking to William Parker about this is worth sharing. The 5 things that will help us balance the immune system, because a healthy immune system is what keeps us healthy, folks. 1, you need to eat a healthy diet that's real food, that's low in toxicity, and that's low in stressing out your system and overstimulating things. This is low in sugar, actually cut out all added sugar, and low in processed foods and carbs. Stuff that's highly refined. Basically, as he was saying, we need to go back to being a caveman. Just eat from the land. Eat produce, fruits and vegetables. Make sure they're organic. Like, think of the hunter-gatherer. Number 2, biggest factor in reducing stress, infection, cancer inducing cancer was reducing stress. So eat a non-inflammatory diet, reduce stress. This patient of mine was just lamenting the dad, so her husband, this 14-year-old's father, went through horrendous medical issues right around the time a couple years ago where all these problems started. Stress, folks, we don't realize the effect that stress has. So eating real food, a really great diet. Thanks for all of you who are commenting. I can't quite read it without my glasses. I don't have my assistant with me today, but I see you. I'll try to get back on those later. I really appreciate you, and thanks for all the support. Keep the questions coming. Noah, my producer, will help me go through them later. I really appreciate you so much. So eating a non-inflammatory diet, thank you. Wow, that's a lot of smileys or something. Reducing stress. You know what, when you watch TV, that's stress. There's no question about it. We're built sort of physiologically and immunologically to be scanning for danger, right? Well, when you're on the news and you're seeing something's going on in Korea, they're rattling their swords, so to speak. We've got the president doing the same. Oh, it's fear and doom and gloom, right? Those things aren't happening to you right now, but it feels like it is, and your stress levels goes up, and it's not good for that immune balance we were talking about. So eat a non-inflammatory, real food diet. Do everything you can to reduce stress. Just turn off the TV. Go do something that's relaxing, whether it's gardening or a walk or whatever it is that's just non-stressful. Number 3, and I agree wholeheartedly, it's funny that he would put this high on the list, but vitamin D, folks. This is the simplest thing we all need to be doing. You need to take adequate vitamin D. Vitamin D is actually a hormone. VDR receptors are all over our body, and including our immune system and our brain. And it's also tons of articles showing you need optimal vitamin D levels. We're talking in the 60 to 80 nanograms per deciliter to prevent cancer. So on this issue of the truth about cancer, you need really optimal vitamin D levels. So we're going to eat healthy, real food, non-inflammatory food. Get rid of the sugar, the processed food, like a caveman hunter-gatherer. You're going to reduce stress, and you're going to take vitamin D. If you're an adult, you need at least 5,000 international units. Yes, your mainstream doctor says that's too much. Well, get your levels checked and prove it for yourself. All right? If you're not taking a supplement, I can almost guarantee you your levels are below 30. Remember, optimal is 50 to 80. Some would say 60 to 80. And a newborn can take 1,000. I'm a pediatrician, and I've got all my newborns on at least 1,000. Well, basically 1,000 at newborn. You jump it up to about 40-pound kid can take 2,000. Teenager can go up to 4,000 or 5,000. So we've got the non-inflammatory diet. We're reducing stress, and we're taking our vitamin D, getting your levels up. This is huge. Now, exercise and sleep. If you're not getting your sleep, you're stressed. Your body is seeing this as stress, and we need exercise. We're meant to be people who are exercising. And then the final thing, and this is where William Parker is kind of the guru on this, and this is the biome. You're going to hear more and more about this. I'm not the only one talking about the biome, but this is from your mouth to your anus all the way through, but particularly the small intestine and the large intestine. We have trillions of organisms that coexist with us. They're a part of us. They're a part of our immune system. They're a part of our nutrient system. So bacteria are digesting food for us. They're helping us make vitamins, and they're also balancing the immune system, as are parasites. Great analogy. I see a lot of pictures of food. Good job. Healthy food. I could list a bunch. But I want to just finish out by saying on the biome, the idea of parasites, I'll talk more about this in depth. This was just a little intro about the truth about cancer. I want you to watch the series. I put the link in the title of this thing. Sorry, it's a long link. I guess that's the only way I could get you. Follow that link and you can get to the series that's going to air on October 5th through the 7th for free. The entire series, I think it's over 40 worldwide experts on cancer. I wanted to provide that opportunity to you because it just shocked me that this was going to be available for free. So follow that link if you will. But to finish out on that biome, this is the fifth thing that will help you balance the immune system, that will greatly reduce your risk of cancer. And that is, we also are supposed to be in balance with parasites. Oh my God, that's like in the US, it's like fear of parasites. I need to go take an anti-helminth. Well, William Parker is studying the effects of a particular parasite called an HDC. Hymenopterus diminuta cystiscoid, I think I nailed it. Not sure. Sorry, William, if I botched that. But anyway, these little HDCs, it appears they're balancing people's immune systems so that they're not going into autoimmune problems, hyperimmune allergies, or cancer and infection. So it's lowering risk. This is something you're going to learn more about as time goes on. I wanted to introduce the concept. But I just wanted to remind you, this book is available. The series, The Truth About Cancer, will be airing for free in its entirety starting on October 7th. You can sign up now and secure your spot for that. And I just want to thank you for watching. Thank you for subscribing to our channel. Thumbs up, share this all you can, and let's get the word out, because cancer is just one of those huge areas that's consuming and destroying the health of our families, our neighbors, everyone we care about, in fact, everywhere around the world. It's part of our toxic world, but it's part of this whole lack of nutrients, over destruction of that balance of the immune system. So I want to thank you for your brief time here, for watching. I'm Dr. Paul, and we'll talk to you again soon.